We're here with Dr. Padraic Obma talking about elbow pain. Dr. Obma, what are some common reasons for elbow pain?
Elbow pain is something that we see a lot at Prevea Orthopedics. The most common thing we probably see is what's called tennis elbow. That's pain on the outside of the elbow. I personally had this twice, and it can be very excruciating. Pain with gripping and twisting, even trouble with work and daily activities. Another variation of that is called golfer's elbow, which is a similar pain on the inside of the elbow. Same pain with gripping and twisting, just a little bit less common. A third thing that we see in younger athletes, especially baseball and softball athletes, are ligament damage around the elbow that can sometimes even require like Tommy John type procedures. The final thing we will see, it's more traumatic, is people can have biceps tendons in their elbow that get injured, and that creates a pop in the elbow, and people pretty much know something happened with that.
And how do you know when it's time to call the doctor?
If you're experiencing elbow pain that's leading to trouble at work, waking you up at night, or you're avoiding daily activities that you would otherwise like, that's a good indication to call your doctor for a further workup.
Why is it so important to seek help and not put off medical treatment for elbow pain?
Yeah, pain in general and elbow pain specifically can cause significant impacts to quality of life. And as we have such a vibrant population who is really wanting to do more and more, if you're limited with your quality of life, that is a setback that you probably don't need to accept. It's a good time when you're having significant elbow pain to call your doctor at Prevea, and we'll take the patient through a full workup to get them back to the quality of life that they desire.
What is Prevea's philosophy when it comes to treating elbow pain?
Yeah, I think at Prevea, although you're talking to an orthopedic surgeon, our primary focus is on conservative care or non-surgical care. I think it's very important to get someone in early when they're struggling so we can educate patients on the condition, recommend activity modifications or bracing, get into physical or occupational therapy, and maybe even consider injections. It's very rare, other than a significant traumatic situation, that it would require an operation.
If surgery is the right treatment option, what are the common options?
Yeah, excellent question. There's a variety of options depending on what is going on. There could be an arthroscopic procedure through 2 or 3 small poke holes just to clean up a little bit of bone spurs or chips in the elbow. It could be a little minimally invasive incision to cure tennis elbow. It could be, if there's a broken bone, a little bit larger incision to put plates and screws to stabilize the elbow. It's a variety of different things based on the injury.
For a complete list of Prevea orthopedic providers in Wisconsin and for more resources, visit prevea.com/ortho.